Social care crisis needs cross-party solution, says Ed Davey. We're going to read into this piece from the Financial Times, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from the Financial Times with the headline that the social care crisis needs cross-party solution, says Sir Ed Davey. Lessons from other countries highlight the importance of political consensus to fix the chronic funding shortfall. Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. Without a shadow of a doubt, we have many sectors obviously that are in crisis. Obviously immigration, our prison system, our justice system, our education system is not working, our healthcare is in crisis as well. But there's also our healthcare system, while it is in crisis, is also linked to our social care as well. And I do 100% agree that with that there must be cross-party consensus on this one. I don't think it's just something that Labour should just ram right in, and especially given the campaign that the Lib Dems had solely on the importance of the environment and on healthcare, especially social care, because that's obviously deeply personal with the Liberal Democrat leader. I do think that there should be some cross-party consensus. However, at the end of the day, it is up to Labour what they want to do, because whether we like it or not, they have a majority, they have the say in the House of Parliament. We can hump all we want about how the election doesn't feel right and the first past the post system's not fair and all that yada yada yada. But this is about obviously the best way of fixing the social care crisis. We all have disagreements about how it should be funded, the way it should be done, but it is in crisis, and we need to make sure that everybody gets the care that they need and the care that they rightfully deserve. Whether it is those who are on the end of life, those who have suffered horrendous disabilities or whatnot, whatever the reasons for them, whether if that is British people, whether that's bringing in people from abroad to help plug the gaps, one of those two things, and building up training programs and initiatives in order to get more people into it, whether that is also raising the raising the wages necessarily for people in the workforce as well, would also help doing that as well. So there's lots of factors obviously around social care, and I do hope that Labour does tackle this as best as they possibly can. So let's read a bit more into what they've had to say here. So Liberal Democrat leader Sir Ed Davey has called on the government to seek a cross-party solution to the crisis in social care, declaring that he's ready to sit down with ministers and start those talks whenever, wherever, basically. His Clarendon follows a general election campaign in which social campaign was barely mentioned, despite the millions of people affected by England's increasingly threadbare provisions for the elderly and the disabled. Liberal Democrats alone made social care central to their electoral pitch. The lack of a detailed plan from Labour and the Conservatives has highlighted England's long-standing struggle to solve a problem addressed by a host of comparable nations. Japan, Germany, the Netherlands and Scandinavian countries have all found solutions that have weathered changes of political administration and found broad public support, underlying the shrewdness of cross-party approach. While Streeting, the new Health and Social Care Secretary last month, endorsed this principle, telling the BBC he was absolutely committed to building a national care service over the course of the decade, bringing people together across the political divide. The Times reported at the weekend that Labour was planning to set up a royal commission in an effort to find a consensus, although insiders were suggesting no final decision had been made about the best way to proceed. But over the past quarter of a century, the UK government has failed to find a dubious way forward for the care system facing a chronic funding shortfall and a recruitment and retention crisis large in 1 in 10 vacancy. Wait, 1 in 10, that's really, that's bad. That's not good, guys. And the chronic funding shortfall has been down, but that is down to the Conservatives there. The austerity, obviously, that played a role in that as well. Streeting has committed to introducing a cap on lifetime costs. Any individuals must contribute towards their personal care in England, a policy backed by successive Tory administrations but repeatedly postponed. Social care is a devolved matter, and Scotland operates a different model to England, with over 65s and younger disabled people receiving free personal care. Natasha Curry, the Deputy Director of Policy at the Nuffield Trust think tank and Authority on Social Care, acknowledged that limiting the sums that an individual must pay towards care costs should be part of any reform package. However, she argued that English politicians focus on protecting older people's assets, and particularly their ability beneath their homes and their children's, rather than selling it to meet mounting care costs, and had made it harder to frame a convincing case for change, both the Treasury and the public at large. It's always about the individual. When you look at where Germany and Japan started, it was from a point of view of we need social care as a vital piece of national infrastructure, she added. The debate over social care, in which many people still believe is providing free, like healthcare, to evolve as the debate over childcare provision has gone, she argued. It is now accepted by all parties that if you don't have a childcare system, people can't work and they don't have a functioning society. We need to get social care into the same sort of framing to be able to really shift it out of the toxic place it is in, she added. Yeah, I do agree that there needs to be, they do need to get it fundamentally changed, yeah. Because the system, what we have right now is not working. That is for sure. And sometimes, yeah, I know it's easy for people to say the solution is, well, just throw a chunk of money at it and that'll fix the problem. That's not always the solution. It's making sure that if investment or money goes in, is it going in the right places? Is everybody playing their part? Is it a case of some bad apples working in certain sectors and departments that are letting the sector down as well? There's lots of mitigating factors. Obviously, a review would be helpful as well. The UK's adversarial political culture has made it hard for fresh ideas to get a hearing. It is 14 years since last attempt at behind-the-scenes cross-party talks, led by then Labour Health Secretary Andy Burnham, collapsed. Shortly afterwards, hostilities resumed in earnest when Labour proposal for a national care service to be funded through an estates tax, which was branded a death tax by the Conservatives. Yeah. Because nobody believes, because what people don't understand is that taxes are actually good for the country. You know, people don't understand that without taxes we wouldn't have the things that we have. You know, like public services and your bins being cleared out, for example. In 2017, Theresa's made proposals to reform the means testing to make it more generous, but to include the value of individuals' properties in calculating entitlements to support for home care was demolished as a dementia tax by Labour and other opponents. In a system like Germany, for example, which is more or less used to coalitions, I think there is a more fruitful political environment to say, okay, let's look at this proposal. What are the pros and the cons? And then to get some sort of agreement, says Curry. Martin, a senior director at the German Ministry of Health, said politicians have recognised that as far back as the 1970s that a stable and fairer system of revenue raising must be devised to pay for the long-term care. It is taken until the 1990s, and only then after 4 years of discussion, for politicians to agree for a long-term care insurance with premiums linked to income. Although concerns have been growing in recent years about the spiralling cost of an ageing population, this consensus has held through the years, he said. Years of debate and also preceding a decision to change the structure of long-term care provision in the Netherlands, according to Nick Zollerzield, a senior researcher at the country's Centre of Excellence in the Long-Term and Social Care. From 2006, a mixture of public and private insurance had been introduced to pay for care, he said, and since 2015, the emphasis has been on moving people out of big institutions to be cared for in the community or their own homes. The country's consensus-driven civic and political culture has been crucial to embedding the changes, he suggested. Even King William Alexander has been involved, Zolazing said, twice using an annual speech to the country to underline that we cannot afford this old model of institutional care anymore. Interesting. As well as consensus that can withstand changes of government, international experiences suggest that key to creating a successful long-term care system is a clear link between the sums being paid by citizens and improvements to provisions. In Japan, a system of long-term care insurance was introduced in 2000, covering people aged 65 or over and other needing care for conditions such as Alzheimer's, stroke or diabetes. Half of the money comes from taxation and the other half from premiums paid on sliding scale according to their income. Nakari, I can't pronounce that middle name, sorry. Apologies. Professor Emeritus at Keio University, Tokyo, who has served on government committees for care for older people, has said that the premiums were much more popular with the public than regular taxation. perhaps because they could see the tangible difference the spending made to service that benefited their own parents or grandparents. For the Nutfield Trust charity, France offers a glimmer of hope for the UK. She says that the country has striven for many years to achieve a lasting settlement for social care, but the French government has recently named it as its fifth pillar of the country's welfare state. They're still struggling with the actual reform of the system, but I think that kind of framing and signalling to the population this is an issue of national significance and as important as health as health and your pension. It's really interesting, she added. It is very interesting. That is definitely for sure. It is very, very interesting to say the least, guys. Some interesting ideas and concepts, obviously, there. I think, obviously, the Japan one, obviously. We also have to take into account, obviously, it's a different culture, different society. Just because another nation does things a certain way, doesn't necessarily always mean that the public here would be on board with it. It's like trying to introduce some things that are over in America to here. It doesn't always just because it's an American thing doesn't always mean it's always going to work here as well. But there are some ideas, obviously, floating about when it comes to the reforms of social care. And I do think, I do hope that West Streeting comes up with some practical solutions. And it's not just a case of, like I said, it's not just a case about throwing money at the problem. Yes, of course, investment needed. Wages need to be, there needs to be a look at the wage structure as well. There's absolutely needs to be looked at that. And they need to be looking at not just recruitment, but retaining people that we already have in our social care. How can we retain them with better pay, better terms and conditions, for example? These are all questions and stuff that needs to be sorted out. And I generally do hope that they take some ideas from the Lib Dems when it comes to social care. Like even I don't care if they pinch ideas from another political party if it means that makes the social care system better. Because at the end of the day, that's all we want is a better social care system. And that's what really matters. If it makes people's lives better, if it takes some burden off their sons and daughters who look after them, then all the better. And I think that's the really most important thing. But those are just my thoughts. What do you guys think? What do you guys think about the social care crisis? What do you guys make of some of the ideas from other nations there? Or perhaps maybe you're from a country that has a very good social care or a very bad social care. Maybe you guys can share those thoughts and more in the comments section down below. If you found this video interesting, please hit the like button. We greatly appreciate it. Share it across social media so others are notified of this video. And subscribe, because it really does help support the channel. And if you want to go one step further, financially support me and the work that I do here, you could do so by becoming a YouTube member for as little as 99p. Or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching. Hope to catch you all very, very soon.